Welcome, everybody. This is the Rotary E-Club of Silicon Valley. Every week, we bring you stories that are designed to inspire you to see possibilities for how you can be of service to others. We are part of Rotary International, 1.2 million people in 36,000 clubs around the world who live by the motto, service above self. And we find ways working together to help communities near and far in all sorts of respects. And there are small projects we do, such as the little thing, that might be involved in helping with the local school. And then there are really, really big things. And one of the biggest ever taken on by Rotary is the project to end polio. You're going to get to hear a little bit of that story today. We have with us Wyn Spiller, who is a past district governor in 5190. She is in the Sacramento area here in California, and we are excited for her to be joining us. So with that, Wyn, I hand it over to you. Thank you for joining us as part of the Rotary E-Club of Silicon Valley.
Thank you so much, Rustin. I'm happy to be here. A middle-aged woman walked slowly to the microphone, leaning heavily on her cane. She was a polio survivor, now suffering from post-polio syndrome, requiring multiple surgeries and long rehabilitation. She had contracted polio at the age of 7, and she spoke of the fear and isolation both during and after. She described a moment when she, just a little girl, was lying in a hospital bed alone, frightened, partially paralyzed, and her doctor telling her that her doll, Mary, her only doll, her best friend, would have to be burned. We have come so far, and yet our unwavering commitment is needed now more than ever. Dare to Dream is the title of a documentary that was created by District 7620, the story of polio eradication, a story that began with an idea, as you probably know, to immunize all the children of the Philippines against polio. The year was 1979. By 1985, Polio Plus was born with the idea of raising $120 million and immunizing all the children of the world. In 1988, we went knocking on the door of the World Health Organization. Hello, we're Rotary. We want to eradicate polio. Rotary, aren't you just a service organization? Yes, and a leadership one as well. We have 1 million boots on the ground, volunteers all over the world, and $247 million in our pocket. WHO said, come on in. And the Global Polio Eradication Initiative was born. Our partners, WHO, UNICEF, CDC, and Rotary International. Later, we were joined by a powerful and steadfast partner, the Bill and Melinda Gates Foundation, and then by the Gavi Alliance, another great partner. And we should never forget the governments of the world because they are key partners as well. What a journey it has been. When we began, 350,000 cases a year in 102 countries, 3 types of wild polio virus. Today, just 2 cases in 2 countries and just 1 type of wild polio virus. 200 countries, over 20 million volunteers, more than 3 billion children immunized, and it takes more than once in a lot of the developing world. Over $17 billion invested and more needed. I know these figures so well, and yet I didn't really understand the breadth and depth of stopping this disease, really reaching every last child. And then my husband and I went to India. We went door to door, all kinds of different homes, extremely well organized. There's a great picture. But many processes still done very much by hand. In each week-long National Immunization Day, as you might remember, whoops, there we go. Each one of these, 170 million children in India are vaccinated, 240 million houses are visited, 2.3 million vaccinators deployed, and 155,000 supervisors. And remember, that these occurred more than once a year. When they were trying to be certified in India, they occurred 8 times a year, in addition to some additional sub-national immunization days. In addition to the sheer magnitude of the work, think about the leap of faith needed to allow a stranger, sometimes from halfway around the world, to put 2 drops of vaccine in the mouth of your precious child. This is a video, an older one, from Pakistan.
शर्म ना करें, मैं लग सकता हूँ।
रात दिन मैं तुम्हारे लिए ही सोचता हूँ। राब्ते में रहने के लिए जो मेरे बस में है मैं कर रहा हूँ। यहाँ रहने में मुझे कोई दिलचस्पी नहीं। मेरी तमाम सोचें तुम्हारी तरफ पलट जाती हैं। घर जैसी कोई चीज़ नहीं। बहुधा घर जैसी कोई चीज नहीं।
आगे तो बोले।
मैंने माजी में कई गलतियां की हैं और जो तुम्हारे साथ हुआ मैं वादा करता हूँ कि आप लोगों की सेहत का ख्याल रखूँगा। मुझे खबर आई है स्कूल में तुम्हारा दाखिला हो चुका है। इंशाअल्लाह बहुत जल्द पढ़ने के काबिल हो जाओगे। मेरी दुआ है कि यह तुम्हारा पहला खत है।
और नाम क्या लिखूं?
नाम तो मुझे लिखना आता है। हौसला रखो। और मैं भी।
Courage and commitment. And when we layer on civil unrest, war, we began to understand the depth and breadth of the courage and commitment that's needed to see our way to the end. So as mentioned, here we are today. Great news, only 2 cases, the last 2 from January. The new strategic plan has been released called Delivering on a Promise. Now, full eradication means not only the elimination of the wild polio virus, but it also means the elimination of the circulating vaccine-derived polio virus. The circulating vaccine-derived is rare in terms of percentages, but it's somewhat significant in terms of numbers. But we have a new weapon in our multifaceted arsenal, and that is the novel vaccine, NOPV2. It's as effective as our current oral polio vaccine, but with less tendency to mutate and cause vaccine-associated polio. The novel vaccine is just the latest in the series of innovations that have been created while fighting polio. Another is a disease surveillance platform that enables real-time detection of suspected polio cases using cell phones. So surveillance officers visit routinely healthcare clinics checking for any child that has polio-like symptoms. The information is fed back real-time and to national and regional authorities who can mount rapid action. The system also detects and responds to other vaccine preventable diseases like measles, yellow fever, tetanus, even cholera. So the app is providing something that we haven't had in the field before. In the past, someone would go out into a distant rural area and not be able to pinpoint exactly where they had been so that others could follow up. It's really quite a remarkable system. It even allows the officer to answer a series of questions, type those in on the phone, and send it back again, real time, and even without an internet connection. Surveillance of all kinds, including environmental, water and sewage for sure, is key to our eradication efforts. So when are we going to be there? Well, delivering on the promise sets out a pretty aggressive program with interrupting the transmission of the wild polio virus, goal number 1, and reporting the last case of circulating vaccine-derived virus, goal number 2, by the end of 2023, and certification by the end of 2026. So we have a lot to look forward to. Of course, check my little screen there. COVID, we learned through the pandemic that sudden and unexpected events can drastically delay progress. And emerging risks are there: lack of government engagement, waning donor confidence, poor operational performance, insufficient support in the local communities, which of course brings us to Afghanistan. This photo was taken before the fall of Afghanistan. We are politically neutral, and we work with whatever government is in place, including the Taliban. And so far, they have supported continued eradication efforts. In fact, on August 23rd, a Rotary-sponsored vaccination hut, roadside, provided vaccines to children under 5, with Taliban providing security. The health minister, who has been guiding the polio eradication efforts, is still in place. And we are optimistic, cautiously optimistic. When we have delivered on our promise, when we have reached every child, when we have eradicated polio from the face of the earth, our legacy will be even more, because we will have proven that there can be a successful, coordinated global response to global health issues. Our health infrastructure, our 146 surveillance labs in 92 countries, already doing more than just polio work. Our knowledge in the field that has already been used to stop Ebola outbreaks and COVID-19 response. An integral part of our new strategic plan is to ensure close cooperation with all other broader health efforts, because it is very important that in addition to eradicating the virus, we have left a polio infrastructure that will continue to benefit public health emergencies long after the disease itself is gone. Dare to Dream reminds us how people, each one of us, can, with vision and determination, come together to change the world. One of my favorite speeches by Bill Gates occurred a few years ago in New Orleans. And he said, the greatest monument won't be the ones we illuminate. It'll be the one we create. The eradication of polio will ultimately be a monument to scientific achievement. It'll be a monument to organizational excellence. It'll be a monument to persistence. And it will be a monument to humanity's ability to come together on behalf of those most vulnerable. And it will be a monument to one thing more. It will be a monument to those Rotarians who gave service above self life. I've always enjoyed this. He said, "Your work has brought us so far, 99% of the way there. This last 1% will be the hardest and the most difficult, but I'm 100% convinced that it's winnable. Rotary has written so many chapters in the history of this fight against polio. Your work, your voices, our Rotary Foundation. These are the things that will allow us to end the story and close the book." Thank you.
Thank you, Wyn. What a wonderful update on how polio eradication is taking shape and taking shape in its home stretch. So wonderful that we have the chance to hear that. We have with us on our call in this recording several members of our club as well. So in addition to Wyn visiting us from Sacramento, we have in Livermore here in the Bay Area, Phil. Feel free to wave at the camera, Phil. We have in Houston, Texas, Rory. And in Castelbordino on the eastern coast of Italy, we have Cecilia Babkirk. Good to see you, Cecilia. My name is Rushton Hurley. I'm the charter president of the Rotary E-Club of Silicon Valley and the programs guy. And I am excited for us to have a chance to ask you some of the questions that have come up as a result of what you shared. So Phil had a question about the vaccine-derived polio. What is the prognosis for one who gets vaccine-derived polio?
It's the same. It is a form of polio. It's just vaccine-associated polio is what it is called. So what happens is that as the oral polio vaccine goes through the digestive system and out, polio is transferred largely sort of from hand to mouth and, fecal movements as well. And so what happens is it's excreted, and over time, in an area that has low vaccination rates, a very small percentage can mutate and create what's called vaccine-associated polio.
So does that mean that the person who receives the vaccine is not the one who actually has vaccine-derived polio?
Correct.
And do we know how many cases there are of vaccine-derived polio, or is that just a function of how things develop in given areas?
We do, and I should remember, I think we're a little over 300 right now this year.
Okay.
So it's not in different countries. So these are in lots of different countries, and part of why the surveillance efforts are so important in checking water and sewage and things like that is seeing if there is any virus that is in those bodies of water and sewage and so forth, because that triggers the knowledge that there needs to be more vaccinations in that area. And
certainly emphasizes the need for healthy funding of the effort, for sure.
Yes, it does.
Cecilia has a question. Cecilia.
So when I, as you may know, served in the Peace Corps in Ethiopia until the pandemic brought all of us volunteers back to the US, and really to my great surprise and delight, I learned that the polio infrastructure that had been created and was still actively involved in Ethiopia because of vaccine-derived polio was being used to train. They basically turned all the teachers in all the public schools into community health workers, and they were going around and teaching people about, hand washing and social distancing and all of that for COVID. And so, I just thought that was something for us to be so proud of. And I'm assuming that was true in a lot of countries. And I feel that it's probably one of the reasons that a lot of African countries have not had the same incidence of COVID as we have. They're better at community health.
Yes, and absolutely true. So when the pandemic hit and all the door-to-door immunizations had to stop, the whole infrastructure really, our famous word for this past year, pivot, and began focusing on supporting COVID-19 response. So you're exactly right. Hand washing, all kinds of hygiene knowledge. Our infrastructure provided personal protective equipment. Some of it even had the End Polio logos on it. So made a huge difference. I know the call center in Pakistan became the call center for all things related to COVID, in addition to polio, and that is still true. So we have continued to support other public health emergencies, and it is indeed something we should be very, very proud of.
In thinking about the variety of organizations that have come together as a part of this eradication effort over time, in Rotary, we have focused quite heavily, and rightly so, on the contributions of the Bill and Melinda Gates Foundation.
Yes.
So the putting forward of phenomenal amounts of money for us to match, in order to end polio has been obviously one of the big drivers. Can you say a little bit about some of the other partners who may not have had as prominent a role in or prominent like in our telling of the stories, but who have contributed in heavy ways in some other respect?
So if you noticed in a number of those photos, you saw people wearing WHO vests and things like that. So WHO and UNICEF in particular have been very active out in the field, helping, keep up the cold chain and helping volunteers reach all these children. And you saw some of the pictures. I mean, it is fairly daunting when you realize the challenges to reaching every child, nomadic areas, nomadic tribes, people who are in extremely remote places, and the importance of reaching every last one. So they are very involved in on the ground activities. Of course, Bill and Melinda Gates Foundation and Gavi, the Vaccine Alliance, has come in as a partner, also supporting all of these efforts. And it's given us just a really strong basis upon which to fight this disease.
Good deal. I believe Phil has a question.
Yes, I may be showing my lack of knowledge about polio, but all the discussion seems to be in vaccinating children. How about adults? Is it worthless or what?
So the polio mostly attacks children under the age of 5. So that's the focus on immunization. Now,
I see the children are more likely to contract.
So they are the ones, they are the primary ones. Now I remember there was an outbreak in one of the countries in Africa. And when we did have those outbreaks, fortunately, Africa, the region, as you know, is declared polio free right now. The teams that went in to do massive vaccinations in the area did vaccinate older children as well. So they went up a bit in age, but the folks who were primarily vulnerable are the children under the age of 5.
Well, I have another comment about that. Since adults we know are transporting the disease, so that the adult can carry it even though it doesn't, I don't know what you would call it, but they would not contract the disease, but they can carry it. And that's the way the disease spreads across countries so easily from travelers.
Through travelers, yeah. So I am not as familiar with the adults, the adult part of it. So appreciate hearing that. Mm. It is true. It is very easy to spread.
Yeah.
I'd like to also actually mention Rory as a part of this this program, because Rory is one of our members who every week makes a donation and makes a point of saying, put this towards ending polio. Rory, I'm putting you on the spot, something fierce, but could you talk a little bit about what inspired you to do that?
Yeah, Preston, I'd be glad to. Everybody can hear me okay?
Yep.
I was born in 1949. So when I was like the summer between first grade and second grade, my parents basically said you were going to have a really bad summer because things you could do would be like when the good humor guy came, you could get an ice cream bar. They said, no, not doing that. Can't go to public swimming pools because you might catch the polio. And, you know, life went on, we got the sugar cubes. And I never personally knew anybody who had polio until in my previous club, which I was a member of for many years, we had somebody who eventually became president who, you know, didn't hide the fact he had polio and still walked with a leg brace. And then a year or two later, we had a very nice lady who joined the club who didn't show any signs of having had polio. But one day, just, you know, away from the club, we got together to have lunch. And she told me about her experiences the first few weeks before she started to respond to treatment. And she was my age, so she must have been 6 years old. And just the thought of being stuck in a completely strange environment with, you know, everybody acting like you're going to die, you know, is just something horrible. So putting the two experiences that I learned from my club, I decided insofar as I have any control over the matter, I'm going to stick with Polio Plus.
It's a great decision. Thank you. There are so many stories. I remember visiting in San Francisco at a club there, was talking about polio and some other things. And one of the women there had been a nurse during about that period of time, the late 40s. And power, they had intermittent power shortages, and the entire staff of the nurses in the hospital had to take shifts hand cranking the iron lungs, which just is, I mean, it's one of those moments that kind of stays with you. That and the story that I told about the doll, these things really make it so important, I think, that we realize the value of what we're doing. And if we don't completely eradicate it and we step back at all, the cases will just flourish just as they did before. We'll be at 400,000 in a matter of years. So it really, Rory, thank you. That's the kind of commitment we all need to have for the children of the world.
We have about reached that point where we need to wind down the recording. As we always do, we'll keep talking with our speaker after we finish the recording. It's a perk of taking part in our program activities like these. But for all of you who are visiting us, whether you are members or whether you are a visitor, please let us know you were here. There is an attendance form just a little bit down in the meeting page from where this video sits. And then a little bit farther down, you'll see our discuss forum. And that is a space where you can talk about what you think of the program, what you think of other elements of the meeting. You can respond to ideas that have been shared by others. We all try to do this quite civilly, of course, so, you know, but we welcome your letting us know what you think. And so with that, what we will do is what we always like to do, which is to hand it back to our speaker for the final word. Wyn, the microphone is yours.
Thank you. I think the parting thought for me is the importance of this work and the opportunity that each one of us has to be part of this incredible legacy. Not only, again, of eradicating polio, only the second disease ever to be eradicated, but also the legacy of global health infrastructure, learning how to work in conflict-torn areas, very remote areas. These are things that are going to stay with our global health efforts forever. And we have so much to be proud of. So thank you all for your continuing support of polio eradication.
Thank you, Wyn. And for everyone, we will see you next week.